everyone, I am Dr. Thomas, your functional medicine doctor, and I have another interesting and informative video for you this evening. Now, today I'm going to talk about urinary tract infections, commonly known as UTIs. This is a very common problem that plagues a lot of women and men to a lesser extent, but more so are women. And it tends to also get named the honeymoon cystitis because it tends to occur right after sex, a few hours or a few days. The symptoms are pretty common, and your regular general practitioner or your family doctor can diagnose this very easily. The symptoms usually include burning on urination, frequent urination, small amount of urine that causes intense belly button cramps. You may even pass blood in the urine, and occasionally the UTI may become complicated where the urine infection spreads to your kidneys, and this may cause back pain and fever. Now, this is very serious. So, a urinary tract infection is not something to be taken lightly. You have to treat it with the seriousness it deserves. A urinary tract infection is not something to take lightly. You have to treat it with the seriousness that it deserves. A urinary tract infection is not something to take lightly. You have to treat it with the seriousness that it deserves. So if you're pregnant, if you're diabetic, if your child has urinary tract infections, these can warrant significant medical intervention. Having been diagnosed with UTIs, the treatment usually involves some type of antibiotic, and these are usually very effective. Sometimes after the first dose, you can start seeing significant changes. But there are times when urinary tract infections may be mild and may not require an antibiotic. Persons who are healthy and have early symptoms, who have been diagnosed with UTI, can do one of a number of different things that will help to alleviate the symptoms and cure your urinary tract infection. Now, at home, there are a number of things that you can do. The first one is to drink lots of water. And in a number of cases, that's all that's required to clear urinary tract infection. Drinking lots of fluids will increase your urine output and flush the bacteria from your bladder and from your urethra, and that sometimes is enough. Many persons have UTIs because they're simply not drinking enough water. You probably want to practice passing your urine often and not holding the urine up. That's a pretty common cause of UTI, to be precise. Women generally aren't as brave and as adventurous as men and may not stop on the roadside or at an arbitrary bathroom to pass urine. So invariably, women hold the urine up very long, and this can cause urinary tract infections. You need to desist from this very problematic habit. The third thing that you can do is have lots of cranberry juice. Cranberry juice has been shown to acidify the urine and kill the germs that causes urinary tract infections. Cranberry juice must be the red one, and the concentrated form is best. But guess what? There's also cranberry tablets. Yes, for those of you who didn't know, cranberry now comes in tablets, which you can buy at your pharmacy over the counter. And this is a very effective treatment for urinary tract infections, especially those who have recurrent urinary tract infections. I've recommended it for patients to take over time as a preventative measure, and is completely safe. Also, you might want to try garlic. Garlic, as you all know from my previous videos, has antibiotic, antifungal, and antiviral properties. So garlic is a very good antibiotic taken as a tea, or some person may choose to dice it and swallow it as a pill. And this has proven to be very effective in mild urinary tract infections. You may also want to try something called cloves. The oil of the clove has antibiotic properties, but my favorite has to be oregano oil. Oregano oil is a master antimicrobial. It kills a whole host of bacteria, viruses, and fungi. So oregano oil is available in most pharmacies or online, and this is very effective, used in drops to treat urinary tract infections. Additionally, you might also want to try out a couple additional habits. So women, I find going to the bathroom right after you have sex to pass your urine is a very useful habit to prevent urinary tract infections. Also, for urinary tract infections, probiotics are very good. So a good quality probiotic may be in the order of 20 to 50 billion, maybe up to 100 billion, with multiple species, especially lactobacilli, are very important and very useful in the treatment of urinary tract infections. They basically promote good bacteria in your system and will help to dissuade bad bacteria from growing. So probiotics are an option for treating mild to moderate urinary tract infections. Now I hope that this information was useful for you. I want to ask you to like, share, and subscribe my video so we can keep bringing more content like this right to your phone screens. See you soon.